Great. So now we've gone from 6 to 12, we've gone school age, and now we're going older than that. They say adolescence is that 12, 21, 12, 18. I mean, it depends on the ages. Usually pediatric hospitals will take up to age 21. And of course, anybody critical will take anybody if they have to. But adolescence, let's talk about them. Adolescent is that transition between childhood and adulthood. So they were a kid, they're acting like a child. Now they have to grow up, smell the coffee, right? Now they've got to figure out who they are, what they're going to be. We're getting close to decide about future and what our role's going to be. Are they be a doctor, a lawyer, or what do we want to be, a teacher? What is it, right? It's characterized now at the beginning of going into adolescence is that pre-adolescent growth spurt. This is something that's 20 to 25% of your whole height and weight that occurs in about 2 years. It's slower than infants, but it's actually pretty quick. So that's why we say it's characterized adolescence by rapid physical growth. That's why, because of that big gain that pre-adolescent growth spurt. And of course, cognitively, now we're thinking. We don't have to see it. It's formal now. Social, we're around people. And of course, emotional maturation. We can understand situations and we can deal with them a lot easier. We say that adolescence is the appearance of those secondary sex characteristics, and it ends when the body stops growing, somewhere between 18 to 20 years old. Now, we do have primary sex characteristics and secondary. The primary is what's there. We need to have a baby. The secondary are things that happen because of all the hormones and stuff that goes on during puberty, okay? So the secondary ones, we know the first thing that changes in girls, the first pubescent change is that they get a increase of their breast buds. You start seeing something occurring there, okay? Boys, the first change is testicular enlargement. So once we start seeing those things going on, we know that that child's going to be going into puberty, right? This is part of what's going on. At age 12, boys and girls should start their 3-dose HPV vaccines as part of the adolescence. Now, we mentioned about the breast bud and the testes being thinner and getting bigger, right? So I did see a couple of questions regarding using Tanner stage, and trying to figure out what stage of development would they be in. So how do you figure out what it is and how do you have the best idea? Well, we know that number 1 is a child. And number 5 is the adult appearance of the boy or the girl. So we only have 3 stages in the in-between. So we know if we're the beginning, we know the girl is the breast buds and the areola enlargement. And we know that that beginning of boys is going to be testicular enlargement. So there's only 2 more stages in between there. Whereas you're getting more hair, more curves, et cetera, et cetera. So if you were to figure out what stage of Tanner's development, usually they're going to have that second stage in there, and that is your testicles or your areola enlarging, your breast buds. As I said, that growth spurt is 20-25%, and that is with puberty. What goes on with it? We know that voice are changing in both sexes. We know that voice changes more in the boys, but girls do have a change in the way their voices do. Now, Erickson, how do I deal with others? How do I deal with others? Well, what Erickson says, it is all about who am I? What do I want to be? What's my identity? It's that role confusion. As in, do I like to be with the band group? Do I like to be with the drama group or the Future Nurses Club, right? This is what do I want to be? And then that's about the role. And then it's talking about I'm too fat, I'm too skinny, my hair's too straight, it's too curly, I've got too many freckles. That body image, they don't like themselves. Now, the problem with adolescence, it's a time of intense feelings of being not what you want to be, that they'd like their bodies to be different. And sometimes some children cannot tolerate that prolonged feeling of not liking themselves or their images, right? So if you start seeing symptoms of whether they're not eating or eating too much, or sleeping too much, or not wanting to go out and with their friends anymore, or you start hearing conversations about death and dying, this is something you really need to take seriously with an adolescent. This is one of those big risks for death, and that is second is actually with suicides. So the social development. Now, we've gone from needing mom and dad and our family for everything, and we depend on them for everything. Well, now we're trying to do what we want to do, and we want to do it when we want and how we want, and we don't want mom and dad to tell us what to do, that parental authority, right? So this is the stage of much ambivalence. So you've got a child who's come up through school age, who's loved mommy and daddy, and but mommy and daddy still has to bring the rules down. You are out till 2 o'clock in the morning Friday. You know, I was too worried. You're not going to go out again, and that's that. And this is part of the frustration of the parents trying to do what they want to do, and a child who just wants to, fit in, be accepted, but they want to do what they want when they want, and they don't want any responsibility with it. And we know part of fitting into their society is their body image. Are they that child who is going to be dressed a certain way or hairstyle a certain way? Or do you need those certain name brand clothes that you're wearing? What is that body image? So, as I said, coming up through school age, you come through needing mom and dad. And then you go through this stage where you're trying to grow up as a child, but mom and dad are still trying to hold you down. They need to because you still don't have, the mental capacity to, do the right choices at times. So this is what we say right about ages 15 to 17. Major conflicts over independence and control, as in they want to do what they want, but they don't want any responsibility. So many times nurses are called in to help with these type of children. And again, it's just sitting down guidelines, having a mediator in there saying, all right, so I was out till 2 o'clock. Well, can I come home at midnight? Instead, this would be something that you would have to sit down together, probably the best choice for parents. Peers are so important, right? Peers will always be that person, they confide in, and it gives them that sense of belonging, feeling of power, right? When you have that peer and that peer groups that you're involved in. They actually say as an adolescent, how you treat your best friend is how you're going to treat your partner for life. If you were good to your best friends and caring, that's the way you're going to be from there on. So again, peer relationships are important. One of the things about working with adolescents is, I worked the last 10 years, I worked in an emergency room. And it's really hard to build up a relationship really quick to get information you need to help that child. You know, I'm looked at as an older woman and I'm the threat, and I'm not going to listen because that's what maybe this adolescent feels and whatnot. So I've got a really short period of time to be able to get on their level, don't I? So I'll always be aware of maybe they have a sports team t-shirt or hat on, or maybe they've got some really neat up to date the newest Nike sneakers, or I see something that's given me a clue or a hint into that child. I'm always going to ask them something about it to try to break open the ice. Can they listen to music? Oh, so who do you like to listen to? What music you like? And maybe I know something about it. Again, I'm looking for something to break the ice to get down with them. Another thing I have found is there are times where you might get a female who is there, and you know that there's a female because of what their name is. But when you look at the adolescent, they are dressing sort of in a masculine manner or could perceived as. I will always ask that person. So what do you want me to call you while you are here? And there might be a difference. But what you have done is you have shown respect to the child. Now you've broken open the ice. Now you can ask the parents to leave the room, and now you can get a really good, maybe it's the sexual history you need. Maybe they wouldn't talk in front of their mom. I know I would never talk sex in front of my mother as a teenager. It just wasn't going to happen. So talking to somebody can help them. As I said, the immunizations is a three shot series, is to prevent cervical precancers and cancers. But yes, we do males and females. Immunizations are important, and any other follow-up will be done. Nutrition. You say nutrition, they should know better by now, right? No, adolescents don't. They grab a bottle of water and a snack bar and they go for the day, and because they're too busy, or they're saving the money to do something they want to do on the weekend, right? So they'll just bring something from home. So they're really not getting good nutrition. So they do need a good multivitamin. And I've said it before, I'll say it again. Any child with any eating habit or behavior, you want to know if they're eating properly. Get a 24-hour diary. This is all you need. That's the beginning. Are they eating the proper foods? How much of it you're eating? How often you eating? You can get that with a food diary. Sleep and rest are important, but we know, what do adolescents do? They're on the phone till 3 a.m. They just met a new boy. They're texting till 5 o'clock in the morning, waking up at 6 and going to school, right? That's just part of adolescence. So we know they're not getting the rest they need. They've got a project due tomorrow, and you're trying to get into this college and you need to get a good grade on it. So you're trying to get that schoolwork done. And you have all the social activities. There's a ball game, and there's a dance going on, and there's a this and a that, right? They're not resting the way they should. Exercising is not anything structured. And of course, dental health's important. They've got all their permanent teeth in. Sexuality, we know, we see a lot of it on the media today on all different forms. Again, any adolescent that are asking you questions is about sex, and it is okay. We can answer those questions, but only facts, only written and oral and written information, not our opinion. So adolescence injury protection, well, hello, first thing always, motor vehicle, right? And then of course any other like that all-terrain vehicle, that'll be one of them. We know firearms will be there, and then sports injury is up there also. We've got kids who are trying to get in scholarships and are out on the football team, and they push themselves, and this is when injuries occur. So, Matt, aged 14, seems to be always eating, although his weight is appropriate for his height. The best explanation for this could be what? What happens at age 14? 12 to 14. It's a pre-adolescent growth weight, right? And he's growing taller and bigger. Is that normal that he's eating like a crazy person?
Yeah.
It's
Yes.
absolutely normal. So look at that question, think of it that way. It answered itself, didn't it? Absolutely normal. All right, let's go to our other cahoots. Any questions? So Kevin, you gonna get first one this one? You were up there. Let's do it again. So remember, I'm still looking for everybody's topics for the pediatric assessment project, which is week 8. I will tell you next week is the week after the exam. You should be doing a part of it so that you don't get everything all due at week 8. So tell me, what do you want to do? What is that project that interests you? If you look at week 8, you're going to see a bunch of diagnoses listed there. They're a guide. You don't have to use them. You can figure anything out that could be a child's diagnosis. Send it to me. I'll say, okay, here we go. Adolescents. Erickson's identity versus role confusion. So Erickson's, you need to know what the names of the Erickson and Piagets are. Absolutely. Also know that if you look at Freud, everything is sex, except for that one, right? Latency. Now, infancy, it's the trust versus mistrust. Toddlers, automatically me, autonomy versus shame and doubt. School and doubt, industry, what do I do well versus inferiority, what I can't do well and feel bad about. So knowing the names. When is an adolescent need to establish their own identity and to form values to live their values by? This is when adolescents need to establish their own identity and to form values to live by. So, adolescents, they're talking identity. Whose identity? That's Erickson. What does Erickson talk about? Who am I and what am I going to be? Role confusion. And it's not just if I'm going to be a doctor or a lawyer, it's also who's my group of peer friends? Is it going to be the drama group or is it the band group or the sports groups? Which one is it? In the identity versus role confusion stage, the adolescents. So when we're talking about adolescence, it's all about who am I, my identity, and who am I going to be? So it's a searching of their sense of self and personal identity. Very good. What age do you have to be to drive an ATV? One of the things that you'll see in every exam is always questions on safety and always stuff on infection control. Those are things you'll always see. One of the questions is the ATV. How old should you be? And 16 is the recommended age, nobody younger than that. Since surviving a sexual assault, she startles easily, feels numb emotionally, and has flashbacks. Her symptoms resemble These are things that you might see with an adolescent that's going through this. Another thing I'll remind you, if you're ever dealing with a situation where you have anybody come in and saying they were sexually assaulted, especially younger children, and you have a parent or caregiver there, remember that parent and caregiver is going through a lot emotionally also. So they're going through their own traumatic stress. Don't forget them. Many victims experience emotional and blank reactions from rape and sexual assault. And it's a lot of, the psychological absolutely does occur, and it doesn't never leave. Which of the following are false about the HPV vaccine series? So HPV could either be 2 or 3 series. They say if they're older than 15, they will need 3, and younger, it would be 2. But for our understanding, adolescents need HPV vaccination, and it could be up to a 3 series. At what age should a parent expect to have major conflicts over independence and control with their child? I'm grown up. I'm going to do what I want to do. I still remember my son. And that's usually at that mid-adolescent. Remember, they're gawky in the beginning and growing and all of these changes going on. And then at 15, they're starting to be feeling more grown up, right? And this is when it starts, where they want to get up, go out, do what they want. And this is where you'll see moms and dads and children, that frustration going on there. I know I had it for sure. What Tanner stage marks the onset of puberty in most males? So we know Tanner's is going to talk about puberty. Stage 1 is nothing, and 5 is when they are adults. So when we're looking at what stage the onset of puberty, males or females, always stage 2. So that's your answer there. And it is the scrotum in males. It's the breast buds, and your areola is getting bigger on females. What marks the onset of puberty in girls? We call it a name, and then we could give you a symptom, right? So we know another name for it is called menarche. What is the physical thing? It's enlarged breast buds, and nipples. What is the Tanner scale used for? And I think now you can look at it and say number 1 is a child and number 5 is full grown adult. And you could figure out the in betweens easier with what I've given you now. So it does, it measures puberty, sexual maturation, it talks about breasts getting bigger and testicles getting bigger and growing hair in places and the voice, et cetera, et cetera. Major cause of death and injury in adolescence is? Major cause. Again, motor vehicle injuries will always be the largest of any injury, safety issue in all age children. And again, the one thing that we see is the preschoolers. They're the one now that all of a sudden are mobile and they just want to run and play and they don't know safety. They don't know cars back out of parking lots or out of driveways and they're being run over and run into, et cetera. So again, adolescents, all ages, it's motor vehicle safety. True or false? Sex education for adolescents aims to provide information to adolescents about issues related to sex. And can we? So, can we talk to adolescents about sex? And can we talk to them freely without parents giving me permission? And the answer is, as a nurse, yes, I can. As long as I'm giving written and verbal information that's not my opinion, okay? Yes, you can if they've asked. How can you get an adolescent to be more receptive to talking about their health and sexual exploration? So the one way is to have the parents leave the room. And, the first thing that that child's going to be worried about is if I talk to you, are you going to be telling my mother, my father, whatever? And the answer is you do not have to tell the mother and father what they said, unless that information is causing harm to themselves or others. Okay. But to give them information about what they said, no, as a HIPAA violation. That is, something that we had in confidence. Keeping a food diary is a first step of treatment for an obese child. Yes or no? And the answer is absolutely yes. It is the first place. In fact, you might even say, so what'd you eat yesterday? Just to get a start on it. It's something that it needs to be evaluated immediately. And last question. An adolescent's been brought to an ER with a drug overdose. What is the initial questions that you need to ask? So you have anybody brought to the ER and you know they're a drug overdose. What do you need to know in order to treat them properly? And we want to know, what did you take? When did you take it? And what type of drug was it? If we've given it IV, it's going to go away actually quicker. If we gave it orally, it's going to last longer. Things like that are very, very important. And to talk about rehab on an overdose, that's not where we start. Right now, it's an emergency. We need to treat that drug overdose. So, how did we do now? Lizzie. Good job, Lizzie. Number two, Mariah. Good job, Mariah. Number one, Brittany. Good job, Brittany. And Madeline Chloe. So we got through a little bit of everything today. Um, I've got a couple minutes if anybody wants to go over. If we could do a couple math questions for about 10 minutes, and then I can let you go for the day. How does that sound? How do I? So I knew with the quiz not going to be here, I knew that we would need a little bit more. So hold on a second. Let me